Hello, my name is Dr Carvalhal. I'm a surgical oncologist working in Lisbon. Besides surgery, I have a passion for wound care. And today I will be sharing with you some thoughts about incisional care. We all know the surgery doesn't end with the last suture. After finishing the surgery, we need to choose wisely what kind of dressing and what kind of wound care we want for our patients. This is why wound care, in my opinion, should be a surgeon's role too. And today we will be talking about some issues and some advices that I would like to share with you. There are different types of wound closure. Primary closure is the one that we are used to use in surgery. We also have secondary closure and also delayed primary closure. So for this session, we will be focusing only in primary closure. We all know there are three main wound healing phases. The first one joins together the hemostasis and the inflammatory phase. This is called the cleanup phase. After this, we have the proliferative phase, where the new matrix is built, and this is the build-up phase. And after this, we have the remodeling phase. Hemostasis lasts from the moment the incision is made up to 48 hours after the surgery. And after this, the white cells are called into the wound and we start the inflammatory phase. These first white cells, then called the first fibroblasts, that come into the wound. This first phase happens for the first week, more or less. The proliferative phase can start within the first week up to the 6th week after the surgery. And within this build-up phase, we have angiogenesis, fibroplasia, wound contraction, and in the end, epithelialization. This is the phases that compose the proliferative phase. And after this, in the end, we have the remodeling phase, where the newly formed collagen is cross-linked into the final collagen, where the wound tends to recover to the final tensile strength. This last phase, the maturation phase, can start around the 6th week after surgery, and it can go up until 1 year or sometimes even more, up to 2 years after the surgery. We all know there are risk factors for patients undergoing surgery. Most of them are intrinsic factors, like patients' comorbidities, like diabetes, cancer, medications, and also some of their lifestyle factors, like smoking, immobility, different types of physical activity, and also extrinsic factors, the surgical factors like surgery length, complications, the need for transfusions, blood loss, all that factors, either the ones related to patients or the ones related to surgery, have a huge impact in the type and the frequency of complications related to surgery. Other key parts of factors that can have an impact in complications are the consistency and the type of wound care patients get after surgery, and also how effective can we be in educating the patients and their carers in what kind of wound care they should have. So the healing process is made to succeed, and fortunately, most of the times it does. But there are complications can occur, and the most common complications related to wound care are hematoma and seroma, infection, and dehiscence. Also, not using the appropriate wound dressings can cause skin damage around the wound, and these kind of skin damages like blisters or skin maceration can secondarily become infected and cause complications not directly related to the surgery, but related to the type of dressing you use in your incision. It is well established that early mobilization is very important to enhance recovery after surgery. This is true not only for abdominal surgery, but also across different specialties to prevent deep vein thrombosis and to make sure patients recover fast and smooth. So, therefore, dressings that are stiff, that are not comfortable, should not be chosen by teams that want to make sure their patients' recovery fast and smoothly. So this brings us to dressing options. There are a number of dressings you can choose from tape and gauze and island dressings up to advanced all-in-one dressings and negative pressure wound therapy dressings. Evidence shows us that negative pressure wound therapy can help in preventing complications like infection. And also, evidence supports the use of negative pressure closed incision dressings to prevent infection in the high-risk setting of surgeries like very high-risk patients or very high-risk surgeries. And also, there is more and more evidence showing that the advanced all-in-one dressings with silicone can, by being more skin-friendly, they can limit the skin damage around the incision and also diminish limit the complications. For these more advanced dressings, evidence is showing that longer wear times and also being skin friendly can optimize wound healing at the light of the new concept of undisturbed wound healing. So let's continue this topic reviewing the features a perfect dressing should have. It should be flexible, well fixed, absorbent, skin protective, waterproofed, with no dead space between the dressing and the wound, and comfortable. The emerging concept of undisturbed wound healing means that you should keep the dressing on for as long as possible. This can optimize wound healing and also reduce the amount of contamination from the outside into our surgical wound. Reducing the dressing changes reduces the cost because we need not only less dressings, but also less nursing time and less traveling from patients coming back and forth to get care. This means you don't have to change the dressing habitually. Change the dressing only if you need to do something onto the wound, like suture removal at 7 or 14 days. Please do not forget the dressing should be changed if you suspect something is not okay. If the dressing is saturated, if there is excessive bleeding, if you suspect an infection can be going on because the patient is unwell, and also if you think the dehiscence can be occurring in your wound. In these settings, the dressing should be changed. To achieve optimal surgical wound care, you should start in the OR. When you finish suturing, clean the skin, dry the skin, and choose wisely what kind of dressing you want to apply on your patients. After that, educate your patient and their carers to daily inspect the wounds and go for a dressing change only if needed. In summary, from a dressing perspective, every dressing change exposes the wound to contamination from outside into the wound. Also, if it damages the skin, it can even increase contamination starting in these skin lesions. Also, a dressing that serves as a good barrier is a dressing that lets the patient shower. Next, the dressing should not be a constraint for patient's mobility. We all know mobilization is a key to a fast and smooth recovery. Last but not least, every unnecessary dressing change means more consumables, more medical waste, but also more nursing staff and more traveling. So choose wisely and never forget, ensuring proper wound care and adequate healing, it's not an option. It's a key part of the surgeon's role.